Hi, my name is Brittany Moore. Today is November 15th, 2025, and I am recording my musculoskeletal video assessment for MSN 572. I am in the FNP program at United States University. Here are my ears. And then here is, my computer screen. And this is my volunteer. Can you tell me your name and your date of birth?
James Moore, January 24th, 2014.
Great. How old are you?
11.
Awesome. So he is 11 years old. He's not old enough to consent for himself legally, but I am his mom, and I do give consent for this assessment to be videoed and uploaded to YouTube as unlisted for my professors to view and grade. So I'm going to go ahead and start with my room scan. So this is where my computer will be, on this little stand in the office, or sorry, not the office, the closet. There's just some instructions down there, no notes. That's the door. I obviously have to leave it open. And then, oops, let me see. Behind the door is nothing. All right, and then let's see. Let me go over here. There is no one in this room except myself and my volunteer. And this is everything behind me. You can see the floor, my workstation. And then this is the bed that I'll be using. And then there's nothing here. And then here again is the floor right in front of us. And the entire ceiling, and I just don't want to get out of the view of the camera. All right. Okay. I am washing my hands with hand sanitizer before I begin the assessment, and I'm going to go ahead and get started now. Let me make sure that is in a good spot. Hi, my name is Brittany Moore. I'm a family nurse practitioner student from United States University. How are you today?
Good.
Good. I will be doing a musculoskeletal assessment on you today. Do you have any questions about what that is?
No.
Okay, so I'm going to go ahead and get started. So I'll just be assessing some muscles and some joints and some bones. And if you have any questions, just ask, okay?
Okay.
All right. So first I'm going to start with the hands. And I'm going to do everything bilaterally, just to start the video with that. So as I'm looking at the hands, I'm looking for any redness or swelling, any deformities or nodules, any atrophy, or any asymmetry. His hands are symmetric, and I do not see any abnormalities of his hands, either side. I'm going to start by palpating. So I'm going to palpate the distal interphalangeal joint. Can you not play with that? Thank you. So I'm going to start with the distal interphalangeal joint. Let me know if you have any pain, and I'm going to be feeling for any swelling and any nodules. Any pain?
No pain.
Okay, and then the proximal interphalangeal joints. Any pain?
No pain.
And then the metacarpal phalangeal joints. Any pain?
No pain.
Great. And then I'm going to inspect the wrists, and I'm again looking for any deformities, nodules, redness, swelling, atrophy, or any asymmetry. And I see symmetry, and looking at his wrists, both sides of his wrists, they appear normal. I'm going to go ahead and start palpating. Let me know if there's any pain. So these are the metacarpals, and I do not feel any nodules or any swelling. Do you have any pain?
No pain.
And then the carpals. Any pain?
No pain.
Okay, and there's no nodules, no swelling, no abnormalities. So let's do some range of motion with the fingers and the wrists. Okay?
Okay.
So the first thing with the fingers, you're going to make a fist. And then you're going to abduct your fingers, and then adduct your fingers, and then flex your fingers down, and then extend your fingers up. Good job. And then we're going to, with the wrists, we're going to flex your wrists down 90 degrees, and then we're going to extend them up. Good job. And we'll put them flat, and then we're going to do adduction, and then abduction. So that's ulnar deviation and radial deviation, okay? Did you have any pain or tenderness with any of that?
No.
Okay, so no abnormalities, and his movements are fluid and smooth. So next I'm going to move on to the elbows. And as I'm looking at the elbows, I'm inspecting the elbows for any nodules, any asymmetry. I'm looking for any redness or swelling. and I am not seeing any deformities, no nodules, no redness, no swelling, and his elbows are symmetric. So I'm going to go ahead and start palpating. So I want you to tell me if you have any pain. So this is the olecranon process. Any pain?
No pain.
Okay, and there's no nodules or swelling. And then this is the medial epicondyle. Any pain?
No pain.
If there was pain here, this would indicate golfer's elbow or baseball elbow. And then the lateral epicondyle. Any pain?
No pain.
Okay, and if there was pain here, this would indicate tennis elbow. And then the extensor surface of the ulna. Any pain?
No pain.
And so there is no pain in any of these locations, and there is also no swelling, and there's no nodules. So let's do some range of motion really quick. So I'm going to have you flex, and then extend, and then when you put your hands out like this, like you're holding a bowl of soup, this is called supinate, and then we're going to pronate. Good job. And then we'll supinate again. Awesome. And did you have any pain or tenderness?
No.
Good. We'll go back. I forgot to do the special test on the wrist. The special test on the wrist is a test for carpal tunnel. So we'll go ahead and do that. So the first one is the Tinel test, or Tinel's sign. So I'm going to hyperextend the wrist, and then if you have any pain, numbness, or tingling in your index finger, middle finger, or the lateral portion of your ring finger, I want you to let me know, okay? So as I'm tapping the median wrist, is there any pain or discomfort?
No pain.
Good. We'll do the other side, same thing. And then any pain or discomfort?
No pain.
Good. And then we're going to now do the phalanx test. So this is called the dorsal surface of your hand. So put your hands together like this, upside down. And then you would make a right angle. Good job. Like that. And you would hold this with pressure against them for about 40 to 60 seconds. And if you had pain in any of that location on your hand that I was just talking about, then that would be a positive sign for carpal tunnel. Do you have any pain?
No.
Okay, so there's no pain, so we're going to go ahead and move on. So we've done the special test for carpal tunnel, and then I've described the area of tennis elbow and golfer's elbow on the elbows. There's no special test for the elbows. We'll move on to the shoulders. So I'm looking anteriorly and posteriorly, and I would have the shirt off in the clinic, so I'm just going to verbalize it here. So I'm looking for redness or swelling. I'm looking for joint symmetry. I'm looking for any muscular atrophy. I'm looking for any deformities or nodules, and I'm not seeing any abnormalities, and that is a normal finding. So next I'm going to palpate, and I'm going to start by palpating and let me know if there's any pain. And I'm palpating for any fluid or any swelling. So this is the acromioclavicular joint. Can you stand up for this one? This will be a little easier. And then face me. Pardon me. So this is the acromioclavicular joint, and then the acromion process, and then the biceps groove, the subdeltoid bursa, and then the tubercle of the humerus. Do you have any pain or tenderness?
No.
Okay, so there's no pain or tenderness, and I didn't feel any swelling, and there was no fluid in any of that area either. So we're going to do some range of motion exercises. So I'm going to have you flex your arms up 180 degrees. Good job. Any pain or tenderness?
No.
Okay, and then extend them backwards 60 degrees. Good job. Then we're going to abduct, which means away from the body. So we're going to abduct them out 90 degrees. Good job. And then we're going to adduct 90 degrees across the midline. Good job. Any pain or tenderness?
No.
Okay, and then internal rotation, which is your hands on the small of your back with your elbows out. Good job. Any pain?
No.
Okay, and then external rotation. Any pain?
No pain.
Good job. And all of his motions are fluid, and there's no abnormalities. So next we're going to test the supraspinatus, which is a test for the rotator cuff, to see if you have a rotator cuff tear, okay? So you're going to put your hands out like you're holding 2 cans of Sprite, okay? And then I'm going to have you flip your hands over like you're dumping those cans of Sprite out. Do you have any pain or tenderness?
No.
Do you feel like your arms are weak?
No.
Okay, and if I were to push down and you push up, are you nice and strong?
Yes.
You feel nice and strong. So I don't feel any issues or any loss of strength with the supraspinatus. So no rotator cuff tear. Okay, and so next we're going to do the head and the neck. As I'm looking at the head and the neck, I'm seeing that the head is normocephalic and it's atraumatic. I'm not seeing any asymmetry. You got to come this way a little bit so you're still within. Thank you. I'm not seeing any asymmetry. I'm not seeing any lesions or nodules or anything abnormal. His posture is upright. The neck is symmetrical, and that is all normal. So now I'm going to start by palpating. So the first thing I'm going to palpate is the temporal mandible joint. So I'm going to have you go ahead and open your mouth while I palpate this. Do you have any pain?
No.
Okay, and then go ahead and open your mouth and wiggle your jaw side to side. Good job. Do you have any pain?
No.
Good. And there's no clicking and there doesn't feel anything abnormal. The next thing I'm going to have you do is measure the maximal opening span of your mouth. So I'm going to have you open your mouth as wide as you can. And then I'm going to have you don't have to put your 3 fingers in, but take 3 fingers and put them like kind of towards your mouth like this. Good job. Okay, so that would be an indication of the vertical span of his maximum opening of his mouth, which is the 3 fingers, and that's normal finding. So I've already done that. So I'm going to palpate the sternoclavicular joint, which is right here. And then, do you have any pain or tenderness?
No.
Okay. And then I'm palpating the cervical spine. Do you have any pain or tenderness?
No.
Okay. And I'm not feeling any nodules or any lumps or any abnormalities in either of these places. No fluid. And then the paracervical muscle. Any pain?
No.
Okay. There's no nodules. There's no knots. No swelling. And then the trapezius. Any pain?
No pain.
Okay. And then the rhomboids down here. Any pain?
No pain.
Okay. And so there's no abnormalities with the head and the neck. So next I'm going to do the range of motion. So range of motion is I'm going to have you, do you want to sit down for it? There we go. Okay. So range of motion is going to be your chin to your chest. So we're going to flex your chin down and then we're going to extend your chin up. Okay. Good job. And then we're going to do some lateral rotation of your head. So your chin over your shoulder and then your chin over your other shoulder. Good job. And then we're going to do some like lateral flexion. So this is going to be your ear to your shoulder like this. And then the other side. Do you have any pain or tenderness with any of these movements?
No.
Good. Okay, so he's able to complete these movements. He doesn't have any pain or difficulty doing these. He's got pretty steady movements. So we did flexion, we did extension. We've done that. The next thing I'm going to do is the Sperling test, which is a special test for, cervical nerve root compression. So I'm going to have you, perfect, you're in just the right position. I was going to have you just do lateral flexion and then look up a little bit. Good job. And then I'm just going to apply a little bit of pressure. Do you have any pain?
No.
Okay, so if he had any pain or I was able to recreate any pain, that would indicate an possibility of that cervical radiculopathy, and we don't have any, so that's a normal finding. You would never do the Sperling's test on an elderly person, a frail person, or anybody with a previous spinal injury or spinal disease, and so that we will move on. So the next thing I'm going to do is I'm going to move on to the lower extremities. As I'm going through looking at the lower extremities, we're going to start with the feet and the toes. And the first thing that I'm looking at is I'm looking to see, let me put this down a little bit lower. The first thing that I'm looking at is I'm inspecting the feet and the toes, and I'm inspecting for any plus planus is the first thing I'm inspecting for, and then I'm inspecting for any plantar warts, any deformities or nodules. I'm looking for any bunions or corns, calluses, or any asymmetry, any swelling or redness, and I'm not seeing any abnormalities with the feet. And so the next thing I'm going to do is I'm first going to palpate, let's see, I'm going to have you scoot back a little bit. You can scoot all the way back. There we go. So I'm going to palpate and tell me if you have any pain, okay? So this is palpating the interdigital neuroma or Morton's neuroma. Do you have any pain?
No pain.
Okay. And then you could also go this way. Any pain?
No pain.
Okay. And then I'm also checking for plantar fasciitis. Any pain?
No pain.
Okay. And that is a normal finding. So now I'm going to palpate for the distal interphalangeal joint. Let me know if there's any pain. And then the proximal interphalangeal joint. Any pain?
No pain.
Okay. And then the metatarsals. And I'm not feeling any nodules. I'm not feeling any swelling. And there's no asymmetry. And I don't see any deformities or any problems with the feet. So now I'm going to have you do some flexion and extension with your toes. So I'm going to have you curl your toes under. So flex your toes. Flex them really good. Good job. And then I'm going to have you extend them up. And then I'm going to have you spread them out, like abduct them best you can, and then adduct them back together. Then I'm going to have you invert your feet and then evert your feet. Good job. Okay, so his feet are normal. There's no abnormalities with them. Next, I'm looking at the ankles. As I'm looking at his ankles, I'm inspecting for any discoloration. I'm looking for redness or swelling. I'm looking for nodules or any deformities. I'm not seeing any abnormalities of the ankles. So I'm going to palpate. So I'm going to start palpating the lateral malleolus and let me know if you have any pain, okay? Any pain?
No pain.
And the medial malleolus, any pain?
No pain.
Okay, and then the Achilles tendon
No pain.
and the gastrocnemius.
No pain.
Okay, and there was no nodules, there's no swelling in any of those locations, and that's a normal finding. Again, I am palpating these bilaterally, so I'm able to compare. I'm able to compare strength and then symmetry, and I'm not finding anything abnormal. Okay, so we're going to start with some passive range of motion. So passive means I do it, and then active, you're going to do it, okay? So the first thing I'm going to do is we're going to do a dorsiflex. So relax your feet, okay? So dorsiflexion, plantar flexion like you're driving a race car, and then circular rotation. Okay, any pain or numbness with any of that?
No.
Okay. And then we'll do that. Okay. Can you do that yourself? Good job. Okay, so he's got full range of motion of his feet. I did mention there's no plus planus. Okay, I did all of that. And so next I'm going to inspect the knees. So as I'm inspecting the knees, the first thing I'm looking for is the valgus or varus deformities, and I'm not seeing any, so that's a normal finding. I'm looking for any deformities, redness, swelling, nodules, and I'm not seeing, or any asymmetry, and I'm not seeing any problems with the knees, and that is all a normal finding. So I'm going to start by palpating the suprapatellar pouch. Let me know if there's any pain.
No pain.
Okay, there's no swelling, there's no crepitus, there's no nodules. I'm not feeling any abnormalities here. And then the sides of the patella, there's no swelling, there's no deformities here. Any pain?
No pain.
And then the popliteal fossa, and I'm not feeling any Baker's cysts. So that is a normal finding. Next, I'm going to do some easy range of motion with you, okay? So we're going to do some passive range of motion first, so I'm going to help you. So I'm going to, let's see, I'm just going to flex your knee up, okay? So let go, or just relax. There we go. Flex and extend, and then flex and extend, and then I want you to do it. Flex and extend, flex and extend. Great. Okay, so the next thing I'm going to do is we're going to do some special tests for your knees. So this is a valgus test, a varus test, valgus test, varus test, the Lockman's test, the drawer test, and the McMurray's test. So the first two tests, the valgus and the varus. So the valgus test, the MCL, which is the medial collateral ligament, and then the varus test tests for the lateral collateral ligament. And so those are the two tests we're going to start with. So I'm actually going to have the pillow go right here. Is that okay?
Yeah.
Okay, and I'm going to have your head right there. Okay. And make sure I'm in the video. Good. Okay, so the first one is the valgus test. And the valgus test is testing for the medial collateral ligament. So because it's testing for the medial collateral ligament, let me put this up so I don't have to bend over so much. There we go. I'm going to place my hand on one hand on the lateral aspect of the knee, and then my other hand is on the medial aspect of the ankle and the foot. And then I am just going to attempt to abduct the lower leg, and I'm looking for laxity in that MCL, and I'm not seeing any laxity in this MCL or the medial collateral ligament, and so that is a normal finding. So we'll go over and do this on the other side. So again, because we're testing the medial, I'm going to have my hand on the lateral aspect of the knee, and then my other hand will be on this medial aspect of the ankle and the foot, and I'm going to attempt to abduct. So abduct away, and I'm not able to. There's no laxity in the MCL. So now I'm going to do the LCL, or the lateral collateral ligament. So to do this one, I'm going to place my hand on the medial aspect of the knee and my other hand on the lateral aspect of the ankle, and I am going to try to adduct, and I'm not seeing any laxity in the LCL. So now we'll do the other leg. So we'll do the right leg now. And again, we're going to try to adduct and I'm not able, oops, sorry, that was wrong. I'm doing the LCL, sorry. I'm gonna have my hand on this medial, and then I have my other hand on the lateral. I thought that felt weird. So I've got my hand on the medial aspect of the knee, and I'm doing the varus. This is the varus test. And the varus test is adducting, and the first test was the valgus test. So I'm not seeing any laxity in the LCL or the MCL, and so that is a normal finding. The next test is for the ACL and the PCL, so the anterior cruciate ligament and the posterior cruciate ligament. We're going to do this bilaterally. It's the Lockman's test, so I'm going to put the leg at about 20 degrees, and then I'm going to put my one hand here to kind of support the lower part of the femur, and then my other hand here at the tibial tuberosity, and I'm going to push and pull, and I'm trying to feel for any laxity in that ACL or PCL. So I am pushing and pulling at the tibial tuberosity, pushing and pulling on that lower leg of that tibia, trying to see if there's any laxity, and there's not. So we'll do this on both sides. Again, supporting the femur, and then at that tibial tuberosity, pushing and pulling, and there's no laxity of the ACL or the PCL. The next test is the drawer test. So I would put the leg at 90 degrees, and then can I sit on your foot?
Yeah.
Okay, so you have to sit on the foot for this one. And then you put both of your hands here at the tibial tuberosity, and you kind of anterior and posterior. So you're pushing and pulling, trying to see if there's any laxity in that ACL or PCL. And so there's not any laxity in this. You gotta hold still, okay? There we go. All right, and then we'll do the other leg. I'm not going to be able to sit on this one, so just because of where it's at, but I would sit on it with permission from the patient, and again, pushing and pulling and feeling for laxity in that ACL or that MCL, which is the anterior cruciate ligament and the posterior cruciate ligament. The next test is the McMurray's test for the meniscus, and so I'm going to flex the knee up, and then I'm going to internally rotate the lower leg or the tibia, and then I'm going to internally rotate as I am extending the knee, and I'm feeling for any crepitus, I'm feeling for any laxity, and then I'm asking, is there any pain?
No.
Good. So we will do the other side. So again, we're going to come up, and then we're going to support this leg, and then we're going to internally rotate as we bring the leg down, and that's to test the meniscus, and that is the McMurray's test. Again, there's no crepitus, there's no laxity, and did you have any pain?
No.
Good. Okay, so the next test, so we're done with the feet and the ankles, and we're done with the knees. So the next test is the hips. Again, I would have, in clinic, I would have the patient disrobed appropriately so I could view this. So the first thing I'm looking for at the hips is I'm looking for alignment. So I would start on the right side of the bed, which I am on the right side, and then come around to the left to inspect the alignment. His alignment is symmetric and it's appropriate. The next thing I'm going to do is I'm inspecting for any symmetry. I'm inspecting for redness or swelling, nodules, or any deformities, and I'm not seeing any, so that's a normal finding. And then I'm going to start palpating. So the first thing I'm palpating for is the anterior superior iliac spine, which is right here. Do you have any pain?
No.
Okay, and that if there was, and I'm not feeling any fluid, I'm not feeling any swelling. I'm now also going to palpate back here for the posterior superior iliac spine, and then the sacroiliac joint, and then the greater trochanter, which I can feel. And I, again, am doing all of this palpating for the entire assessment. I am palpating bilaterally, so that way I can compare side to side, and then also for timing. Now, because he's thin, it's easy for me to access that posterior side. If he was not, I could have him bend his leg and then internally rotate his hip a little bit, and then I would have better access to palpating his greater trochanter and then palpating the posterior structures that we're looking for. But I was able to do that without having to do that. So next we're going to do some range of motion. So first thing we're going to do is some flexion of the hip and then extension. So we flex up and then just extend it back to baseline, and then flex up and extend back down to baseline. and then we're going to do some internal and external rotation. So external and then internal. Oops. And then external and internal. And then we're going to do some abduction 60 degrees to the lateral and then 30 degrees across the midline. And then we're going to do abduction 60 degrees, laterally, and then 30 degrees across the midline. Did you have any pain or tenderness with any of that?
No.
Okay, do you think you can redo it?
Yes.
Okay, so flex, so lift your legs up. Okay, up at the hip and then extend back down. Up at the hip. Good job. Extend back down. And then can you do that internal and external rotation where we, okay, abduction. And then adduction. Good job. And then abduction and adduction. Good job. What about can you do the rotation? Where you go up. Good job. And then can you do one more? Good job. Awesome. Okay. And so there's a couple of special tests that we'll do for the hip. So the first one is the Thomas test. And so for the Thomas test, I'm going to have you put your leg up like this, and then I'm going to have you give your leg a big hug like that. Okay? Good job. So as he's doing that, I'm able to see that his other leg remains flat, and I'm able to see that his lumbar lordosis naturally flattens out, which shows me that there is no occult hip flexion contracture, and that is a normal finding. So we'll go ahead and put your leg down, and then we can do the other leg. We'll check both sides. Feels good, huh? Good stretch. Okay, and this one is also normal. There's no flexion contracture. So go ahead and put your leg down, and then we'll do the Faber test, which is the flexion, abduction, external rotation, or the Patrick test. And so what we'll do is we'll flex, and then abduct, and then externally rotate, and put your heel right here above your patella, and then I'm going to push down. Do you have any pain?
No.
Okay, so there's no pain, and then we'll do the other side. So flex, abduct, and externally rotate, and push down. Any pain?
No pain.
Okay, so the Patrick or Faber test is testing for any hip disease or possible sacroiliac joint disease, and he doesn't have any abnormalities. There was no pain with any of that. The next one that I'm going to do is I'm going to test the spinal special test, which is the straight leg test, just because he's already laying down. And so we're going to lift your leg up. Any pain?
No.
Okay. And then any pain?
No.
Okay. If he had any pain, it may be an indication of some lumbar radiculopathy or sciatic nerve pain is what that is called. So I'm going to have you come stand up next to me. Okay, good job. And so first I am looking at his posture. I am looking at the height of his shoulders and the symmetry of his shoulders, and they appear to be symmetric and normal. I'm going to have you turn around because I got to look at your back. Great. So as I'm looking at his backside, I'm seeing that his, again, shoulders are symmetric and his posture is upright. I'm seeing that go ahead and stand up tall for me, thank you. His iliac crest is symmetric and even. And then I would also look at the skin folds beneath the buttocks in clinic. I'm not going to here. Again, I would have this patient disrobed appropriately in clinic, but for the purpose of the video, he will be clothed. And so I'm not seeing any concerns here for any scoliosis, but I'm going to have him go ahead and bend over forward. So do a 90, there we go, 90 degrees. And so as I'm looking, he had symmetric movement as he went down. And then as I'm also seeing, his shoulders are symmetric and even the height of them. His shoulder blades are symmetric and even the height of them. There's no abnormal curvature of the spine. And then the iliac crest and hips are also an even height. So I don't have any concerns of any scoliosis in this patient. So go ahead and stand up straight. And then I'm going to look at you from the side. And as I am assessing from the side, I'm noticing that there is no cervical lordosis, there's no dorsal kyphosis, and there's no lumbar lordosis, and that is a normal finding. So now I'm going to palpate. So I'm going to palpate on your spinous processes and the intervertebral spaces. So let me know if there's any pain.
No pain.
Okay, so there's no pain in any of these areas. I'm not feeling any nodules. I'm not feeling any bulges, any swelling, or any abnormalities. And that is all a normal finding. Next, I'm going to percuss. So let me know if you have any pain. I have my flat hand, and then I'm going to use the ulnar side of my fist to give a soft thud. So,
No pain.
okay, so no pain, and I'm not feeling any abnormalities either. And that is a normal finding. So next we're just going to do a little bit of range of motion exercises. So we've already done some like neck range of motion, but now we're going to do the rest of your back. Okay, so you've already shown me that you can bend over 90 degrees. You flexed forward and did a great job. So now I'm going to have you extend back about 30 degrees. I'm going to stand behind you. Go ahead and extend back. Good job. Do you have any pain or tenderness?
No.
Okay, and then I'm going to have you do a lateral bend to about 30 degrees. Let me get out of your way. And then another lateral bend about 30 degrees. Any pain, tenderness, or difficulty?
No.
Good. And then we're going to do a twist and a twist. So this is like lateral rotation. How does that feel? Any pain or tenderness?
No pain.
Good. That's great. I think that is the entire assessment. Let me think really quick. Make sure I didn't miss anything. I did your fingers. I did your special test of your wrist. We did the phalanx. We did the toes. I think we did everything. I don't think there's anything. I did your mouth. I did this. I palpated your sternum. I palpated your shoulders, your AC joint, your coracoid process, your subdeltoid bursa. I did your toes. I don't know. I did your toes. I did your feet. We did all your range of motion. Did you make big? Yep, you curled your toes under. I palpated your feet. I did your ankles. I don't know. I think my assessment is done.